Hi, my name is Nancy, and this is my YouTube channel on CRPS, also known as Complex Regional Pain Syndrome, RSD, and Reflex Sympathetic Dystrophy. In this channel, we will take a deep dive into CRPS, talking about what it is, how it's treated, and associated illnesses. So stay tuned for more. Today we're going to talk about intrathecal medication pumps. Intrathecal medication pumps are a surgically implanted device. It consists of a reservoir and battery and a catheter that is placed into the intrathecal space in the spine. The intrathecal space is a fluid-filled space between the thin layers of tissue that cover the brain and the spinal cord. This is surgery and comes with all the risks of surgery. With every treatment, it is important to weigh the risks against the benefits to help make your decision. Some of the risks are limited to, but not limited to, but do include infection, reactions to anesthesia, bleeding, bruising and swelling, pain, blood clots, and nerve damage. The benefits of the device are that the medication is delivered into the space surrounding the spinal cord and requires far much less medication intrathecally than orally. The risk of the device itself is it must be refilled. This includes a needle stick. There can be an infection secondarily to the refill, and the catheter can shift out of the intrathecal space. For the most part, there are just two types of medication used in an intrathecal pump. One is a muscle relaxant, baclofen, that's used to treat dystonia and spasticity that is often accompanied with CRPS. The other is pain medication, such as morphine, which is an opiate, or bupivacaine, which is a numbing medication similar to lidocaine. And clonidine. Clonidine helps to make the medication more effective. So, the process. A trial is done. A catheter is placed intrathecally, and using an IV pump, the medication is infused. The patient should experience a decrease in symptoms. Following the trial, the surgery is performed by a neurosurgeon. The device is programmed to deliver a set amount of medication. The device is refillable, and at the end of the presentation, you will see photos of a refill. When the battery is low, the device must be replaced. If the catheter is still in the correct place, then only the reservoir controller is replaced. If the catheter has migrated, the entire procedure must be repeated. In the 1990s, there were 4 treatment options, and I'd failed them all. Lidocaine infusion, and that's when I first got my port, because no one in the hospital could get a peripheral IV in me. So the next day they put in a femoral central line, which is right in your groin, and took me to the operating room to put in a port. Sympathetic nervous system blocks, which I addressed in a previous show, the intrathecal medication pump, and the spinal cord stimulator. Those were the options at that time. A trial was done inpatient first with bupivacaine and then with morphine. For me, the bupivacaine was not as effective in reducing my pain. Morphine was the selected medication. I was referred to a neurosurgeon, and the pump was surgically implanted. I had no adverse side effects. Morphine and clonidine were put in my pump. At that time, refills were done by a home care nurse. Now it's done in a physician's office. Over time, the morphine became less and less effective in controlling my pain. The morphine dose went up and up until it was maxed out. After refilling, the time of the next refill was miscalculated. I was told that I needed to have it refilled December 8th, but the day before Thanksgiving, the pump started beeping. The pump beeps for just two reasons: low battery and low medication. We were weaning me off of the morphine because at that point, ketamine was available, and it is best not to be on an opiate at the same time as ketamine. It took me a few minutes to figure out what was beeping. I put in a call to my CRPS doctor. It was a holiday weekend, and he was at that point changing me from home care refills to a physician. He could not get a hold of anyone until Monday. Tuesday, when at the doctor's office, the reservoir was most likely empty. As I said, we were weaning me off the morphine. But rather than measuring if there was any morphine left in the pump, he just refilled it. Tuesday night into Wednesday, I was vomiting nonstop. I went to the ER on Wednesday, a week after the beeping had started. No one in the ER thought that the pump was the issue. I was given fluids, nausea medication to stop the vomiting, and sent home. Literally, as I walked in the door, I started vomiting again. So back to the ER we went. I was admitted for several days, given fluid and medication to control the vomiting. When I explained what happened to my CRPS doctor, he felt that by refilling a most likely empty pump, the doctor who refilled it gave me morphine poisoning. But we will never know. We will never know if it was withdrawal or an overdose. Also, who's going to Ginger, stop it. So today we're talking with Denise, and we are talking about medication pumps. So I know that you got a medication pump for a completely different reason that I did. Yours was for spasticity and dystonia. Can you tell us what year we're talking about when you were diagnosed?
I was diagnosed in 2001.
Okay. All right. And can you briefly tell us how the pump itself enhanced your life?
Yes. Basically, I'm able to walk a little bit better than I used to be able to walk. Um, the spasticity and more importantly, the spasms that I had basically were in my back and my legs.
Yeah.
Um, really caused me to, I would say, bend over and totally, what's the word I want to use? Totally, I'm sorry.
Okay. I get those now,
Yeah,
but nothing to do with my CRPS.
yeah, totally. I guess lock up or whatever
Mhm.
you would say, and take my breath away. Um,
And did you start on oral?
yeah, yes, I did. I was on baclofen. I was on tizanidine. I was on dantrolene, and at various points, I was on two of them at a time,
Right.
and it made me very tired.
Yeah. And
And
it probably didn't help as well either.
exactly, exactly.
Yeah.
So we eventually decided to go with the pump.
Yeah. Dr. Schwartzman did that with a lot of people.
Yes.
So perfect. And then I have one other question, and that is how ketamine infusions have added to your quality of life.
They have helped unbelievably.
You want to like
Since
tell us a before and after type of thing that it's helped with?
um, beforehand, besides pain, it
Mhm.
has helped with my pain unbelievably. Um, I'm able to move around a lot more. Um, able to help out in the house a lot more. I'm still not able to do, a whole lot, but I can help out a little bit more in the house. Um, I'm able to do more with the kids. My kids are grown, but I can do things
They
with them.
probably weren't back when he started the infusions.
No, I actually didn't start my infusions until 2013. So
Okay.
I'd had it for a long time
Yeah.
because of insurance reasons.
Right.
I couldn't do it. So I wasn't able to, I still participated with my kids, of course,
Right.
but I didn't start till later on. But one main thing that I noticed soon as I started with my ketamine infusions, I was very, very, very swollen. Um, with my CRPS. But as soon as I started with the ketamine infusions, the swelling went down. And it has remained down. I mean, I still get swollen before my infusions, but nothing like they used to be.
Right.
My legs were massive
Yeah.
before I started my
Well, that
ketamine.
in and of itself will help you move around more, not to have the swelling.
Exactly, exactly. Getting any kind of shoes on before was next to impossible.
Yeah.
But now I can wear shoes.
Well, that's cool.
That was a big thing.
Yeah. For me, it worked best on the allodynia. I couldn't
Yes.
wear clothes before I started ketamine. I would wear a
Yeah.
sundress or shorts in the winters of Pennsylvania.
Yeah. I can understand. Still, the allodynia is tough for me, and I can only wear sweats and really
Okay.
soft t-shirts is all I can do at this point still.
And it's just so interesting how two people with the same disease, it affects them differently.
Right.
I mean,
It's
it did
amazing.
help with my edema. Before ketamine, my primary is like, oh no, you must have a cardiac issue because you're so swollen. I'm like, no, I don't.
Right. Exactly.
And to make them happy, I let them do the blood work. So they
Right.
stopped bugging me. And of course, it was normal.
Yeah, they kept doing Dopplers to see if I had DVTs.
Right.
And I'm like, no, it's just the CRPS.
Yeah. Yeah. All right. Well, thank you so much for your help. So this is what it looked like when I was home post-op. It was a same day procedure. You can see the bruising because they had to take it from the front to the back to insert the catheter. This is the beginning of the pump refill. You can see that they are cleaning the area where the pump is with betadine. Then they put on a measuring device so they know where the hole is to insert the needle. The pump is scanned so that they can see what's left, and the needle is inserted into the hole. The medication is slowly pushed into the reservoir. and the pup is then filled. Back then, we did not have cameras at the ready, so this was done over 2 pump refills.